Welcome to Dr. Jeffrey Roth's Looking Good and Feeling Great podcast, live from Las Vegas, with his co-host, Darrell Craig Harris.
Hi, this is Dr. Jeffrey Roth, your board-certified plastic surgeon in Las Vegas, Nevada, and we made it to season 2. Who'd have thought it?
I know. Who would have imagined? Well, we're doing well, and it's fun. You've actually been super busy lately. Tell us what's been going on.
It's been a little bit busy lately, and it's funny because we make a joke about this at the office all the time. It's what bus kind of lets out at your street corner every so often. And
because you never really know.
You never really know, and it's not quite the ER, which you know really what's coming through the door next.
Right.
So you actually you sort of have a schedule sometimes. But lately, the bus that let off has been labiaplasty. A bus came off, and then also ear repair surgery lately, and then a lot of Botox and fillers, because people are kind of emerging from their COVID hibernation,
Sure.
and so it's hair, nails, and Botox at this point.
Yeah, and labiaplasty. It all makes sense.
Yeah, so it all works. So so basically lately we've been getting a little bit busier both in the OR as well as the injectables, the Coolsculpting land, and so everybody is kind of really sort of getting back into the swing of things much as we can. Less restrictions. The governor came out this week. I hope they hold, and I hope they continue to hold, and I hope Vegas gets back to being Vegas.
Yeah, the governor of Nevada. Yeah, because we've had well, actually better than most as far as the restriction goes, but things are sort of getting back to normal, which is good.
Yeah, so we hope the trend continues, and by trend also people not being in the hospital and people not being in the ICU and all of that. And so as that trend gets better, then our trend to kind of loosen up and get back to Vegas being the entertainment capital of the world is
normal
as
Vegas could be normal.
As normal as Vegas can, the quote unquote normal. Yes,
yeah.
right.
So today we wanted to talk.
As I sit in a room with a picture of Hunter Thompson.
Yeah, exactly. So today we actually want to talk about the subject of liposuction, a procedure that's been really popular, and there's been developments and different things that have come along with that. So. I guess that would be one of the busier parts of your... Absolutely.
And liposuction really lends itself to a few things. For example, we'll do tummy tucks and liposuction. We'll do other procedures, and liposuction. And people really like that, even facelift neck lifts and liposuction to get some of the fat away before contouring the muscle and skin. Or when we talk about body contouring, arms and legs, oftentimes we'll do liposuction. And then sometimes knowing that there will be extra skin there, especially in folks that have lost a lot of weight but still have fatty deposits. And so I think it's a good adjunct to a lot of other procedures. So I think that's always kind of in the back of the mind is hey, this is a tool in my toolbox that I could use. And usually people tolerate it really well and they really like it. And especially in those folks that have dieted and have exercised, but they just have that genetic fat that you can't get rid of. For example, my dad and his love handles. Thanks, Dad, for the genetics.
I love your dad, by the way.
That's it. Yeah, so he's free to good home.
He's a good guy.
So no, he's a good guy. I wouldn't trade him for anybody. Well, anyway, so no, it's a tough room. But yeah, so that genetics you can't beat, and so it's those sorts of things. And I've heard this a lot. Now I've had a couple kids, or I've hit menopause, or et cetera, and I'm seeing my mom's neck. I'm seeing the love handles of my neck. So yeah, so we fight against fat all we can, and it's mono and mono, and so we give it our best shot. The other thing too is to be aggressive but safe. And we always go to a certified surgery center, and we have proper anesthesia. But liposuction is very, very interesting. The history of liposuction actually is quite distant. It was first French surgeon started in the 20s, and then in the United States it became
in the 20s.
In the popular,
surprising.
popular, and then really. the big thing is this thing called Tenescent liposuction. And what that means is basically you have somebody that doesn't like how their love handles look. Okay, fine. And you say, okay, we're going to go ahead and take those down for you. Well, you do this thing called Tenescent Technique. And what that is you put in normal saline or lactated ringers, which is the same stuff that you would put in somebody's IV. You go to the operating room, right? They put an IV in, and they hang normal saline or lactated ringers. But you also put in lidocaine, which cuts down on pain, and epinephrine, which cuts down on bruising. Because in the bad old days, it was people were really bruised
right,
up.
Yeah.
So you instill that first through our little incisions. They're about a centimeter apiece. The other thing that's come along over the years is to put multiple small incisions in so that you kind of cross-cut what you're doing. It's kind of like cutting the grass at Dodger Stadium. It's kind of like cutting the grass at Dodger Stadium in that if you cross-cut it one way, it's smooth, but if you cross-cut it two ways, then it's a lot smoother. So same sort of apply.
Sure.
So we go ahead and we instill this Tenescent solution, and we wait a couple of minutes, and then you're able to go ahead and extract the fat along with the Tenescent solution. It comes out much nicer. People are in less pain. People are less bruised. And that really was the aha moment for liposuction. After that, then we go ahead and we contour things, and we say, oh, that looks better, etc. And then the little holes, we go ahead and we put those back together again, and they're about a centimeter. And then folks afterwards, they feel a little bit beat up, and they do have to wear the compression garment, which is kind of like a big Spanx or a big girdle. And in my hands, usually 6 weeks around the clock, and then 4 weeks after that, halftime. Now, at week 4, typically people, believe it or not, will downsize. They'll go ahead and get a lot of the swelling out, and they'll actually be able to downsize from a large to medium.
To see the effects.
Yeah, and so that's kind of fun to see. And then also folks that like to go to the gym, they'll usually like wearing the compression garments for a while, kind of like back in the 80s and 90s. Remember, we had the compression garments and such. And even nowadays, the ball players, they'll wear tights on the court and all that.
Right.
So they like that. And like my cops and my firemen, they come in for liposuction. Yes, real men, get
yeah, because actually that's become more popular with men. Right?
It has. Yeah, 10% of our population in the office is men, and which is about the national average. But for example, the cops, when they're in the 40s, 50s, they don't like the gun belt kind of digging in a little bit. Yeah. And the firefighters, they all just want to look like they stepped off the calendar, those guys. So
I know, it's funny. We always had that vision of them and the guys without the shirts on. Unfortunately, they don't all look like that.
They don't all look like that. No, and they're great. The first responders, God bless them. I mean, they're the guys that run into houses that are burning and about to collapse. Yeah. Those guys are running into people shooting at other people. I mean, God bless them. So,
absolutely.
So we've those guys, usually, and gals, will also wear their compression garments, usually for about 3 months under their uniform, because those folks are always pushing or pulling or dragging or doing something. It's a very
because you want to preserve what you did with the liposuction.
Yes, as always, and of course we always go ahead and see patients over and over again to make sure things look good, etc. And so most people really tolerate it well, and they really like what they see. And in the operating room, we talk about, we're running a lot of miles for this patient today, in as much as we're able to go ahead and take away that fat, which again, most people have dieted and exercised. They did everything right, and it's us against genetic fat.
What would be the average amount of pounds that you would commonly take away?
That's a great question. Is a couple things. One is in an outpatient surgery center, the recommendation from the Plastic Surgery Society, et cetera, is no more than 5 liters.
Oh, okay. Which is a lot.
Lot. So 5 liters it basically is about 10 pounds. Okay. So now, when you first do it, you don't get on a scale and 10 pounds is gone, right? Because you're going to be swollen up, et cetera. And after any surgery, I usually tell the husband or boyfriend, typically, I say, take the scale and hide it in the garage for about a month. Okay,
right? Because the first thing they want to do is jump on the scale,
of course, and especially the tummy tuck folks is they'll go home and go, wait, why am I up 5 pounds? We took off all this tissue. So there's some swelling, but getting back to the liposuction thing is basically we're able to go ahead and give them a nice contour that otherwise they wouldn't have been able to make it themselves. Right. Even with all of the Jane Fonda and the side bends and all that kind of stuff, there comes a point where yes, the genetic fat is just there, and you're able to make a difference into it. Now we get questions all the time about that. One of the questions is okay, how much can you take off? Which we did about 5 liters. And the reason why I do that is because they found that more than that, you start getting funny fluid shifts. And so
that's a pretty big shock to the body, I guess.
Yeah. And some of the older guys back in the day, when they were doing hospitals, they would do 10 liters, and which was a lot.
Right.
And so that's where we kind of got that number from. And so that was kind of the sweet spot, was about 5 liters. And that's kind of the recommendation that came out. But one of the questions that we get is, hey, doc, I just had liposuction on whatever place. Can it come back into that place, or is it going to go somewhere else, right? So what I tell folks is once we do the liposuction, I suck it out, it goes into the canister, and it's gone forever, right? But you can't take out every single fat cell, nor would you want to. Okay. Yeah. Because otherwise, you really look skeletonized, and that's where ruts come from, and all that. So basically, is you still have some fat cells still there. Now, if you go home and eat ho-hos on the couch, yes, you're apt to, it's got to be stored someplace. And oftentimes it'll go back into the quote unquote genetic A fat, as I call it, because that's where genetics wants to put it. Now, sometimes it'll put it into the genetic B fat. Well, instead of being in the love handles, all of a sudden it's winding up in the saddlebags, etc. So it can do that. The main thing is don't eat ho-hos on the couch so much. One, but that really hasn't been a problem, because most folks that come to us, thankfully, for liposuction and body contouring, have made that commitment, and they said, okay, I'm spending resources, I'm spending time, I'm spending energy, and those folks now look better in a leotard, right? And so now they'll go to Zumba class, or they'll go to kickboxing class, or they'll go to spin class, and those folks typically in a year after liposuction, they look terrific. Some of them are shredded, and so some of them, that's really the kind of stepping stone to go ahead and really get themselves back into gear and get themselves motivated, et cetera, et cetera. And we've been very impressed by, thankfully, our patients coming back, and they look great.
What would be the most common areas? I mean, I guess belly would obviously be one of them.
Yeah, so abdomen and flanks, of course, both in male and female. Females, the saddlebags. Sometimes the inner thighs. Now, by the way, inner thigh gap does not exist. Okay, for all of you folks that are on Instagram and picking on people or want the inner thigh gap, forget it. Okay, yeah. 1. 2 is a bit about inner thighs. Inner thighs are tough because every single person, especially females, has some rippling there. I mean, even the skinny models that we get who are,
because there's a genetic component. That
who are 6'2", and you would see them on runways, and they all have it. Okay, they all have it. So, and anything you see again on Instagram and that sort of stuff is usually airbrushed, 1, and 2 filtered, or whatever it may be. So having said that, so you have to be careful in those kind of areas, because if you take too much fat, then some of the ripples and crinkles and such may look a little worse.
Yeah, it's not aesthetically pleasing.
Right. So there's some artistic / scientific balance there, saying, okay, well, I can go from A to Q, well, I can get you from A to F, because if I go further than that, you may have a downside to it. So to answer your question, yes, usually abdomen, flanks. Women hate that little area where the bra is, the little bra fat area.
Right.
Hate it. Yeah. And so we've been doing more and more of that. Also, we've been doing a lot of facial, meaning neck, liposuction here, and folks with a double chin or triple chin or whatever that may be.
Because most people don't typically think of that as an area for liposuction.
Yes, right? It's a tool in your toolbox, whether it is Coolsculpting, whether it is liposuction, whether it is a formal face or neck lift. It's absolutely something in the toolbox. And again, we're seeing more and more people come in because they're staring at themselves on Zoom all day.
Right, sure.
And folks are saying, oh my gosh, I hate X, Y, and Z, and they're coming in for that. Another question that we often get with the liposuction is, okay, doc, let's do it. Let's take 5 liters off, be aggressive as you can, How's the skin going to look? Is the skin going to snap back? So typically the answer is yes. Now, that's why it's important to go, in my opinion, see a board-certified plastic surgeon, because some folks have lousy skin. Some folks, smokers, chronic steroid people,
sun abuse,
and especially here in Las Vegas, please. And I'm a product of the '80s, and it was all Hawaiian tropic, and it was terrible. And the
tanning beds. All this
okay,
stuff.
and then the girls. The baby oil, and then I think we talked about that. The nurses were the worst because they would put the iodine in the baby oil, and we just cooked ourselves. So, having said that, so those may be a little more at risk, but having said that, is usually you can go ahead and snap back, and that's another reason why we like the compression garments, because with the compression garment, you have the skin and then you have the muscle, right? You take out the fat, and you want that skin to really adhere down to the muscle. So that's also to get the skin to heal down, but also that's why you put it on there so you don't get the lumpies and bumpies, because you don't want any fluid in there as well.
That's good
so
to know.
That you really want it to get sticky, and you want it to scar in where you want it to scar in, and that usually really works well. Now, there's been a few folks that I've said, look, you're right on the line between a tummy tuck and liposuction of the abdomen. And we go back and forth for whatever reasons.
Yeah, because there are different options. I mean,
absolutely.
One of the things, actually, maybe we'll cover that a little bit too, is the Coolsculpting option, which you're sort of master practice for that procedure. But
sure.
So what is the tummy tuck in particular? What is the determining factors? What's
Great
the best?
question. So, and this happened a couple times last week. And in my office, we weigh out the pros and cons of all of them, right? So, for example, the gal that's it's usually a gal, but it can be a guy too, is right on the line, right? So, liposuction, usually if it's a doc, I want to get rid of the contour thing. I want to get rid of the bulk thing, and then we can kind of push them a little bit towards the liposuction, and we can cut them down usually 50-75% of what they are now. So that's fine. If they have extra skin or something like that, then maybe better served with a tummy tuck. Now the tummy tucks, basically for those folks that have lost a lot of weight, okay, and it's less of a fat issue and more of a my skin's hanging off of me issue, of course. Also, this thing called Diastasis Recti, which means I have to use some Latin, right? Okay.
It's required.
Right, yes, right. So, right, Latin. So shout out to all the sisters out there. Anyway, so nun sisters. Anyways, and the priest too. We used to have actually in Philadelphia. Those guys would come in, and they were really happy. It was funny because they would go through the cemetery and seminary.
Seminary. Yeah.
Oh my God, thank you. We'll edit that out, right? So the seminary and. So as I'm making priest jokes now, what's going on? So, but I had this priest, and a great guy, and he actually had esophageal cancer, which is not funny. And we went ahead and reconstructed him, et cetera, fine. And so the nurse comes in, and I'm talking to him. And the nurse says, oh, Dr. Roth, do you want that PRN, which stands for pro re nata, which means as needed, okay? And so the priest, ears, of course, perked up because Latin.
He knows what
he knows that. And he looked at me, and I said, it's pro re nata. He says, yes, I know. He says, that is needed. And he says, do they still make you... take Latin in medical school? I said, no, thank God. They don't have to do that. And he was an older guy. And he says, yeah, when we were in a seminary, he said it gave them some relief that another group of professional people were suffering along with them through their Latin and such. But I said, no such luck anymore, et cetera, et cetera.
But those terms still exist.
All the time.
It's all over what you do.
Yeah,
of course.
Yeah, and there's plenty of Greek and Latin in medicine and such. So, but yeah, so those are some of those things that we go through.
So the Coolsculpting in particular, because it kind of is goes.
I'm sorry. So Diastasis Recti. Getting back to that.
Oh,
that's
sorry.
That's my fault. Got crazy with the Latin.
That's okay.
So Latin nights, crazy Latin nights. So diastasis recti. So diastasis recti basically is if your rectus muscles, your six pack, have splayed apart, right? And so, like, especially gals will go ahead and do sit-ups, and they have this thing that keeps bulging out.
Right, they just can't get rid of it.
Can't get rid of it. So that's typically the diastasis recti. Again, not your fault. You can blame your child, which is fine. That basically separated things out. Mm-hmm. So for those folks that want the diastasis recti fixed, your six-pack back, that again pushes you a little bit more towards the tummy tuck because you can't get there obviously through a cannula with liposuction, but when you're there doing the tummy tuck, you have the opportunity to put those muscles back together again, and then you take off the extra skin, et cetera, et cetera. Right. And so that really is
gets
nice.
them closer to the result they're really
exactly
looking for. Yeah.
And here's the best part is, again, liposuction and tummy tucks go hand in hand, meaning oftentimes we'll do a tummy tuck and then we'll liposuction out the flanks, and that really looks nice because it brings it into one big unit. Mm-hmm. And then, of course, again, a lot of women especially don't like the bra fat, and so they'll take that down too. So they get kind of the front side and the back side, and folks really kind of like that whole package when that's done.
How important in plastic surgery, I mean, I would assume it's very important, is asking questions and asking the right questions to get to what they really want, because sometimes they don't really want to admit to you initially what they're really trying to accomplish.
Well, 100%. Like there's a couple of guys you really can't lie to. Is your priest and your surgeon? Yeah, okay. Yeah. Husbands, boyfriends, your mom, okay, fine. Yeah. But those two guys really, not so much. To answer your question is we're taught in medical school that 70 to 80% of your diagnosis comes from the history. Mm. So you really have to, I was taught and beaten into me, that you really have to listen to the patient, because the patient will tell you the diagnosis most of the time, and they'll tell you why they're there most of the time.
So you have to be a little bit of a detective too, right?
Yes, and actually Sir Conan Doyle, as you know, who wrote Sherlock Holmes, he was a physician. And if you read those books, it reads exactly how a physician thinks, because you have a list of possible diagnoses, and then you go ahead and you test your hypothesis. Nope, can't be him. He has an alibi. Nope, can't be them. Nope, can't be.
Yeah.
And then at the end, that's deductive reasoning. And at the end, you find out what the diagnosis is, right? So in medicine, somebody comes in, weak and dizzy, right? So it could be 100 things. Mm-hmm. And so you do the CAT scans. You take the blood work. Do they have too much potassium, too much? And you get down finally to what it can be, and that's what your diagnosis is. Mm-hmm. With Sherlock Holmes, what he would do is again, go through all the clues. Then he would apply hypotheses and keep weeding guys out until he found,
because a lady might come in
the
and
murderer.
She's like, I want to look beautiful, I want to have a flat tummy, but maybe they're shy to actually tell you that.
Right.
But you really you want them to be happy with the end result.
Yes, right? And you try to extract as best you can. And oftentimes people don't have the words to say what they want, and that can be very difficult. I mean, oftentimes as well, I want my stomach smaller. I want my saddlebags gone. Okay, that's pretty straightforward. When you talk about noses are hard to describe, because most folks come in and say, "Well, doc, I want a smaller nose." All right, what do you want? A smaller
what does that
tip?
mean?
Do you want a smaller width? Do you want a smaller? And even the junior plastic surgery residents, it's hard to kind of get them to nail down exactly where you want to go. And that's important in plastic surgery because you want to know what the goal is.
Sure.
So, and then you want to apply your knowledge base and experience to, okay, how do we go from point A to point B? How do we go from this person sitting in my office who looks pretty good and take them through this journey to where they're going to look better? And so, for example, we had one gal, really, really nice gal, wanted breast dogs, and she came in and she was an A cup, right? Fine. And I said, well, what size do you want to be? And she says, I want to be B. I'm like, okay, we can go from A to B. That's fine. Which is great. So, right. And then, right. And then I said, well, do you have a picture? She says, oh, yeah. So she shows me a picture of Coco.
Yeah.
Ice-T's wife.
it was like a, what?
Who
double
was,
D
who was,
right?
a G. Okay. Who was like a B in the third grade picnic, maybe. Okay. And so we said, well, no. I said, well, you have to tell me what you want. And she says, oh, well, I really want a D, but I thought it was rude. I'm like, forget rude. You got to tell me. Okay.
Yeah, because people, I mean, it's because people, I mean, some people are perfectly fine
discussing
those subjects, but some people are shy.
Right. And then some people people say, Doc, I don't know. I don't know what size I want to ask for. And that's okay too, because then we say, well, let's talk about proportion. Let's talk about your hips and your shoulders, and we'll see what proportion is. And I talk people out of surgery a lot. Drives my office manager crazy, okay? And again, if I was, in Beverly Hills, shout out to my Beverly Hills peeps, sorry. Some of them are great, and some of them really overdo it. And it's also not fair to.
It's a bit tricky, right?
It's not fair to the Beverly Hills peeps too, because people come in with crazy demands, and they want every line out of their face, or they want gigantic this or none of that. Okay, so we'll give them a break. Otherwise, I'm going to get lots of calls. But having said that, is for me, I guess in my practice, it's really about finding proportion and kind of getting into why are you doing this, how are you doing this, and I talk to my patients, and again, I have consultants come in and tell me how I'm running my business wrong, and they say, "Oh no, Doc, you're spending too much time with your patients. You could be 7 minutes and out." I'm like,
well, the thing I actually really like about you, because I've actually been there with some consults. Actually, my ex-wife we did a consult about the breast reduction with her. And what I liked about you is you actually take your time and you listen, because some people are watching the clock and how did you develop that way of operating for you personally?
Well, everybody's different. And some of the guys that go in and they do the 7-minute consult and out, and they get great results, and they're really good surgeons and they're good guys and everything. I don't know if it's a style issue or I don't know.
I mean, it has a lot to do with how you were trained, of course. Too,
yes, right? How I was trained, how you brought it. So, and for me, it's really all about is the why. What's your why? Right? We hear about this in conferences. Right? So, but why is that patient in? Okay, and oftentimes it's a big event. It could be a wedding, it could be a reunion, it could be a divorce, it could be whatever it is. But why
change of life?
Why right? Why they coming in? I've had folks come in. We did an otoplasty, which is an ear reshaping, on a gal that had ears sticking out from her head. And she's in her 50s, and she says, "You know what, Doc? The kids are finally in college. They're finally on their own. It's finally me time."
That's great.
And she's been waiting for this operation for 30 years. Yeah. I've had other folks that say, I should have done, after it's done, and blah, blah, blah. Says, I should have done this 20 years ago. I should have done this right after I had kids. I should have done, and lately, again, with the pandemic and people are home and the whole world's a little crazy right now. But we've had people come in that were in my office 7 years ago, 4 years ago, and they said, I'm never going to have this much time again.
Right. That's true. Yeah, recovery time.
Right.
Yeah.
And it says, now's the time to, for some reason in their universe at that particular time, it wasn't right. And I never force the issue. I'm the high pressure sales guy, and my office is not. And so I learned that a long time ago. And if somebody tells you, an elective surgery, if it's a gunshot wound, you got to go. But in elective surgery, you say, Doc, I'm not feeling it today.
Yeah.
You cancel the case.
Right.
So, because
I mean, the thing is, ultimately, you want happy customers, happy clients.
Sure.
I mean, customers is a funny word, but I guess clients is maybe even the better word. But.
Right. So, and there's nothing better for a physician, for somebody to be sent in by a family member or their peer group or their friends, and really, my mom was an OR nurse, by somebody who works in the OR. Mm-hmm. So we got fortunate to get a lot of referrals from folks that work in the operating room, and because they've seen them all. They've seen all the guys. They know who has hands. They know who doesn't. And for us, we like to think that we really take care. For me, perioperative care, taking care of the patient the whole way through from soup to nuts, is important, because I say this to my patients all the time, call. It's okay to call. I'd rather put out little fires than big fires. Right, I want somebody who says, this doesn't look quite right. So they come in, we hit them with a little antibiotics, they're fine, boom. Or, oh, wait, no, that's a suture that's trying to come out. Let's take it out now.
Because it is, people, plastic surgery, they see this stuff on TV, but it is surgery.
It's real surgery, right?
It has its complications at times.
So, yeah, and it's, and surgeons on TV is always great. I grew up on, Dr. Kildare and MASH and, St. Elsewhere and all that stuff. But it's not drive-through surgery. You don't go through and get it done. Because I've had people says, oh yeah, well, geez, I'm getting my operation Friday. I'll be good for work on Monday, right? No. Okay.
Yeah. And actually, and then the subject of going back to liposuction, there is definitely a recovery process.
Yeah. Now liposuction, depending on how much you do and everything else, you'll be beat up, but most folks are back in a week, mm-hmm. and most folks are, functional in 3 days after any operation. Kind of stinks, right? So any operation, pick one, anything else, 3 days always does it. But usually, folks, my my cocktail waitresses and stuff like that, if they get their lipo and stuff like that, most of them are back at about 7 to 10 days.
Okay.
And then they're in their gear, and it's a little bit, ginger
So
and
this is
stuff
actually
like that.
not so bad, right?
Right. So yeah, my boxers not so much, okay, but those guys are usually in good shape. They don't need lipo.
Is the tummy tuck time as far as recovery, is that similar? Or
yeah, that's a little more because again,
you're dealing with muscles.
Yes, so we're dealing with muscles. We're dealing with a bigger incision. We're dealing with that kind of stuff. And again, most people are back at work, usually, a couple, 3 weeks.
Okay.
And again, you're talking to Mr. Conservative here. The other thing, too, is who am I talking to? Am I talking to a female police officer? Am I talking to a nurse? Am I talking to a housekeeper? And those folks have hard physical twisting jobs, as opposed to somebody who's sitting at, Pac Bell in customer service. And that's a plenty hard job, too. Trust me, that's more mentally and emotionally exhausting, but less twisting.
Right.
So,
What
especially if you get my dad on the phone.
What do you like most? I mean, it seems like maybe it's a funny question, but what do you enjoy most about being a plastic surgeon? What's really gets your thing going?
I think the ability to make a difference, being able to look at something and know that I can not only fix but make a difference in somebody's life. And for example, I had somebody the other day says, you changed my life, right? And I'm like, well, no, they said, no, really. He says, because I just got divorced, blah, 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 and I always wanted these, and I always wanted it, and I couldn't wear the stuff I wanted to wear, and I didn't want to go to parties because I didn't want to go because one was bigger than the other one, and one was this, one was that, and so finally we got that all straightened out. And she said, no, you really changed my life, and so that, to me, is the reason why I put my hard hat on and bring my lunchbox to work, and I still like going to work and all that stuff. So, and then we had another patient that came in. This was a few months ago, and she was having issues with her implants, and she thought she had breast implant illness, et cetera, and she was an avid outdoors, person, et cetera, but she wasn't able to do that for a long time. And again, when they come to me for that, they usually are, they've been through all the doctors and everything else, and it's kind of the last resort. Let's take the implants out. And about 85% of those, and I know I select them out, but basically 85% of those that we do feel better. But she, at the end of all of this, she says, Dr. Roth, you saved my life, right? And I'm like, no, I didn't.
Yeah.
I said, I don't do that anymore. I said, when I was in the burn unit, maybe, or when I was in trauma, or when I was doing general or vascular, cardiac, yes, of course, that their lives hang in the balance, and so, and when I did reconstructive, we would on my best day, we would restore form or function. But I said, no, I don't do that anymore. And she said, no, you don't get it. She says, I wasn't me. I couldn't do what I wanted to do.
Because it affects your whole life.
I wasn't seeing my peeps because they wanted to go and do X, Y, and Z, and I was at home. And she says, I felt terrible, and I was suicidal, and I was about to kill myself. I said, what? And she says, yeah. I says, but you did this. I feel better. I'm me again. I'm with my friends again, et cetera, et cetera, et cetera. So that's a bit of an extreme. A lot of people don't
think about that stuff, but actually those things that could be a very personal, those kind of situations, besides just the health effects of the breast implant illness. But people that have those issues, my mom struggled with that too. She has a lot of issues with breast implants, and that is a devastating thing if you don't feel happy about looking at yourself in the mirror.
And the thing is too is and we post stuff on social media, and social media can be a brutal place, as you know. Yeah. And we even recently there are folks, especially gals, that their ears stick out and they don't want to play sports because they don't want to put their hair in a ponytail, okay, or they get made fun of, or girls who are beautiful girls and they're still beautiful even though they have a big hump in their nose, okay, but it's a problem for them, and they don't like the way they look in pictures. And now everybody's got a phone on their hip, right? And so,
and as guys, we tend to whatever, but
right? It's a deal, and so with one operation, you're able to take a hump off, or you're able to pin some ears back, or you're able to go ahead and give somebody their body and confidence back after having kids.
Right.
And so for that, making a difference for me is a big deal. And I try to do that with the medical society. I try to do that hopefully as a husband and a dad and as a son and a brother and a citizen. I try best I can to go ahead and make a positive impact wherever I can go. But and I thankfully picked a career, and thankfully I got enough training, and I try to emulate the guys that train and gals that train me, and be able to make a difference in that theater.
Yeah, I mean, I think that's all we can all hope for, right? To make a positive difference in other people's lives.
Right.
So it's very important.
I hope so. So that's what to answer your question, that's what turns me on is, why do I still like going and doing plastic surgery every day? Because you have the ability, the privilege of being able to make a difference.
How can folks, if they want to reach you for consults, or I mean, you're based in Las Vegas.
Sure, based here in Las Vegas. We get people from everywhere. We've had people from Australia, and they were a lot of fun. The Australians are a hoot. And Canadians, everywhere across the states. So, yeah, it's a very international city. Hopefully it'll be more international soon,
sure.
Again, as things come back to normal. But, yeah, so for us, we are on the World Wide Web at jjrothmd.com. And we have a relatively new website up, so if you find typos, please let us know. That's that part. Also, social media, we're everywhere, and we're getting more and more everywhere as things go on. We're on,
and they can find under Las Vegas Plastic Surgery.
Under Las Vegas Plastic Surgery, yeah. So that's Twitter, that's Instagram, that's Facebook. That's LinkedIn. That's our Google business page. So and they accept MySpace. Okay,
MySpace.
You're still that.
There's no more MySpace.
Not on Friendster, but so much. But yeah, so awesome. No, we're all over the place.
Awesome. And I think in our next episode we're going to cover the subject of brow lifts.
Yes.
Which is another.
Yeah. So that's always interesting. Lots of questions on that. So.
Yeah. Good. And if people have questions, and if there's topics that you would like us to cover, please message us on social or at Dr. Roth's website, again, jjrothmd.com, and we're happy to cover those subjects.
That sounds great. And then and the podcasts are everywhere good podcasts are, which Podbean, iTunes,
iHeartRadio.
Yeah. So just basically everywhere. So within the sound of my voice, which is I guess getting larger and larger. By all means, if you have a question or anything, let us know.
All right. Thank you so much for joining us, everybody, and we look forward to seeing you next time.
That sounds great.
Awesome.
Thank you so much for joining us. For further information, please visit the podcast website link for Dr. Jeffrey Roth. See you next time.